Last week, I have created one video related to basic medical coding series where I have created video related to integumentary system. Today, we are going to see basic medical coding musculoskeletal system. So, these basic medical coding series videos are very helpful for the freshers who wants to enter into medical coding as well as the experienced people who wants to change their company. So, in this video, we are going to see most important concepts related to musculoskeletal system. So what is musculoskeletal system? So basically based on the word musculoskeletal, musculoskeletal system comprises of muscles as well as the bones. So the study of muscles along with bones called as musculoskeletal system. In medical coding, one of the most complex system is the musculoskeletal system. In this video, we are going to see basic anatomy related to musculoskeletal system. And also, if anyone looking for medical coding jobs in India, USA and UAE, please join in our WhatsApp group, which is in the description of this video. And also, if anyone looking for free APC CU webinar links, and also if anyone looking for same day surgery coding training, IPDRG training, SCC training, as well as CCS training, please send WhatsApp message to 707 526 3939. So, if you want to master musculoskeletal system, please watch this video until the end. And if you like this session, please click on like button. So, musculoskeletal system. So, here it is having nearly 26 pages. So, we are going to learn most important topics related to medical coding. Okay. So, as we have discussed previously, musculoskeletal system consists of bones. Okay. So, in human body, we are having 206 bone. Okay. So, what is the use of bone? Support, protects organs, store minerals, produce blood cells in bone marrow. Okay. So, here we are having two types of categories in bones. Axial skeleton consists of skull, vertebral column, ribs and sternum. So appendicular skeletal consists of limbs and girdles, shoulder and pelvic girdles. In the documentation, if you see girdles, you need to remember physician is going to tell shoulder or pelvic. So next we need to understand about muscles. As we have discussed previously, musculoskeletal system consists of muscles as well as the bones. Okay. So for adult human being, 600 skeletal muscles available or exist. Okay. So what are the use of muscles? These are useful for movement, posture and heat production. Okay. And we need to understand what are the types of muscles. So here we are having skeletal muscles which are voluntary, smooth muscles, involuntary, internal organs, cardiac muscle, involuntary and heart. Next, musculoskeletal system consists of joints, places where two bones meet. Okay. So what are the types of joint? Fixed joint, skull sutures. Okay. Slightly movable, vertebral joints. Okay. So otherwise we will call it as spaced joints. Next are free movable synovial joints, shoulder and knee. Most of the time all the shoulder, knee, elbow joints are having synovial membrane, which is the fluid filled membrane which will protect the joints. Okay. And also inflammation of synovial membrane is called as synovitis. Most of the time in the live coding you will see synovectomy. Okay. So removal of this inflamed synovial membrane is called as synovectomy. Okay. Next one is the cartilage. So musculoskeletal system consists of cartilage, which are flexible rubbery connective tissue. Okay. So these cartilage cushion joints and help them move smoothly. Where do you see cartilage? You will see in ribs, nose, ear and joints. Okay. Next, musculoskeletal system consists of ligaments. What are ligaments? So ligaments are the strong bands of connective tissue. These ligaments will be useful for connects between bone to bone. And the main purpose of ligaments is in order to stabilize joints. So this is very very important. So whenever you see documentation ligaments, we need to remember these ligaments will be useful to connect multiple bones or bone to bone. Okay. So next one is the tendons. So tendons are most important concepts in the musculoskeletal system. What are tendons? These are the tough parts of connective tissue. So basically tendons are also connective tissues. These tendons will connect muscle to bone. Remember, bone to bone ligaments, muscle to bone tendons. Okay. So transmit force from muscle to bone for movement. Okay. So next we need to understand what are the functions of musculoskeletal system. So this system will support us by maintains body shape and posture. This system will useful for the movement. This system useful for the protection. This system useful for the mineral storage like calcium and phosphorus in bones. For example, if you go to the physician, so they will provide, if you tell them if you are having any type of joint pain, firstly they will prefer calcium and vitamin D. Okay. Blood cell protection or production using the bone marrow and heat generation, muscle activity helps regulate body temperature. Okay. So these are the functions of musculoskeletal system. Okay. Next, acute traumatic versus chronic or recurrent condition. Okay. What are the acute traumatic conditions? Bone, muscles and joint conditions are a result of current injury or trauma. Okay. So these conditions should be coded from chapter 19 S codes. So basically acute conditions are current injury or trauma. In the documentation, if you see current injury or trauma, you need to use S codes from chapter 19. Okay. So for example, if you see documentation, traumatic meniscal tear, traumatic fracture, traumatic dislocation and traumatic subluxations, these all comes under acute traumatic conditions where you need to use S codes. Next, we need to understand chronic or recurrent conditions. Okay. So bone, muscle and joint conditions are a result of healed previous injury or trauma to the site or recurrent conditions. Recurrent means again and again. Okay. So if the patient is having any type of healed injury or trauma, you need to code from M codes, chapter 13. So examples for chronic or recurrent conditions are internal derangement of meniscal tear due to old or recurrent injury. So in the documentation, if the patient is having injury due to old, you need to use this chronic or recurrent condition using M codes. Okay. Next, acute traumatic versus chronic or recurrent conditions. So these are the basically examples. Joint deformities such as valgus deformity, mallet finger kyphosis, lordosis. So next, pathological fracture, which are due to softening of the bone. Most of the time due to osteoporosis, osteopenia or bone cancer. Okay. So next, if you go to interview, they may ask you what is the difference between dislocation and subluxation. So what is dislocation? An abnormal separation of bones in a joint. What is subluxation? A partial dislocation of bones in a joint. So complete separation is dislocation. Partial dislocation is subluxation. Just you need to remember this one. These two terms you will encounter in the medical coding. Okay. Next, fracture. What is a fracture? So fracture is a complete or partial break in a bone. So we are having multiple types of fracture. First one is traumatic fracture. The name itself indicates this traumatic fracture will be caused by accident, fall or any type of injury. Okay. Few Example for traumatic fractures are fall or accident. Next, pathological fracture. As we have discussed previously, these pathological fractures will be caused by disease rather than an injury. Okay. So examples for pathological fracture is osteoporosis. So basically these are the underlying cause for pathological fracture. Osteoporosis, osteomalacia, Paget disease, osteitis, osteogenesis imperfecta, bone cancer. In the documentation, if you see all these conditions, if the patient or if the physician tells that patient is having pathological fracture, you need to check for these conditions in the documentation, whether patient is having osteoporosis, osteomalacia or bone cancer. Okay. Next one is stress fracture. Most of the time, stress fractures will be caused by repetitive stress or force, often from overuse. Okay. Next example is running long distances. Okay. Next, pathological fracture symptoms: pain, tenderness, bruising, swelling, muscle weakness near to broken bone. Treatment options are calcium and vitamin D, chemo and radiation therapy. Most of the time, these are for bone cancers. Okay. So, casting and splinting, fracture reduction, closed open external fixation, vertebroplasty or kyphoplasty. Okay. So, if you are able to understand this session, it's fine. Still, if you are having any doubts, please mention in the comment section of this video. Okay. Pathological fracture. How do the physician identify pathological fracture? Using the X-rays, CT, MRI, bone scan or PET-CT, DEXA scan and bone biopsy. Next one is episode of care for fractures. Seventh character specificity. Okay. So we are having A, D, G like that. So we are going to see one by one. Initial encounter A. Receiving active treatment for the condition. So most of the time active treatment include surgical treatment, ED treatment, continuing treatment by some same or a different physician. Where you will use seventh character A. Initial encounter or initial treatment. Subsequent encounter D. Receiving routine care after active treatment during the healing or recovery phase. Most of the time the patient came in for follow-up, we need to use D. Follow-up X-rays, removal of external or internal fixation device, medication adjustment and other aftercare and follow-up visits. Okay. So basically here physician has performed the active treatment. After active treatment, if there is any change in the patient's treatment, we need to code it as subsequent encounter D. Subsequent encounter with delayed healing G. Seventh character G. So a fracture takes longer than usual time to heal the fracture site. So delayed healing means basically healing will take time. So that one you will call it as delayed healing or G. Okay. Next episode of care for fracture, seventh character specificity. Next one is K. Seventh character K. Subsequent encounter with non-union. A broken bone falls to heal is called a non-union. Okay. So in the non-union process, broken bone will fails to heal. Okay. And there is a gap between two broken bones. So that one you will call it as non-union, where you need to use K as the seventh character. Next one is subsequent encounter with the malunion P. When a fractured bone heals in an abnormal position, is called a malunion. Here, union occurs or bone heals but in abnormal position. You will call it as malunion. Next one is the sequela. So the residual effect after the acute phase of fracture has terminated. That time we will use sequela or seventh character S. So should not assign a fracture code with the seventh character as S as a primary diagnosis. Okay. So here they are telling that you can't use sequela code as a PDX. Okay. Next, coding documentation for pathological fracture. So what are the conditions you need to check in the documentation in order to code for pathological fracture? So these are the underlying conditions: neoplastic diseases like bone cancers, osteoporosis, periprosthetic fracture and unspecified. And you need to check for anatomical site, whether it is in the ankle, metacarpals, clavicle, femur, fibula, tibia, finger, ilium, ischium, neck, pelvic, radius and ulna. So basically you need to check based on the location where the patient is having the fracture. Okay. Next you need to check for laterality, whether it is right, left, bilateral or unspecified. Okay. We have already seen these seventh characters: A for initial encounter, D for subsequent encounter with routine healing, G for delayed healing, K for subsequent encounter with non-union, P for subsequent encounter with malunion, S is for sequela. Okay. Next, pathological fracture coding guidelines. So, for example, encounter for pathological fracture due to neoplasm. How do you code this one? Pathologic fracture neoplastic disease, M84.5 series. Okay. And specific neoplasm code, C002 D49 series. Okay. Encounter for pathological fracture due to osteomyelitis. Okay. So here M84 series is common. This three category series is common for all type of fractures or all type of pathological fractures. Specific osteomyelitis code M86. Okay. So along with this one, we need to use additional code to identify the organism if applicable or if it is available in the documentation. B95 to B97 series. How do you code if the patient's encounter is for pathological fracture due to osteoporosis? So osteoporosis with pathological fracture, M80 series. And also here additionally you need to use for major osseous defect using M89.7 series. Okay. So what are the guidelines here? Encounter for pathological periprosthetic fracture. In the documentation if you see periprosthetic fracture, you need to use M84 series, and periprosthetic fracture you need to use M97 series. If the patient is having pathological fracture, M84.4. Okay. So this is very important. Sequencing is based on the treatment toward the condition. Assign personal history of non-traumatic fracture if the patient is having previous fracture. So G87.31. Okay. Next one is osteoporosis. So basically osteoporosis is the softening of the bone or decrease in the bone density. Okay. Mostly this osteoporosis is the underlying cause for pathological fracture. Okay. These are the symptoms. Okay. So these are the treatment options: hormonal therapy, SIMS, calcium supplement, kyphoblasty, vertebroplasty. So these are the diagnostic tests. Okay. So what do you need to check for coding osteoporosis? Osteoporosis without current pathological fracture should be M81 series. Osteoporosis with current pathological fracture should be M80 series. So in order to code to the highest degree of specificity for osteoporosis, documentation should include age-related or senile, drug-induced, idiopathic, postmenopausal, post-oophorectomy, post-surgical malabsorption, post-traumatic. So these are the keywords we need to check in the documentation. Okay. As usual, you need to check for the anatomical site, and also you need to check for laterality. Okay. So these are the manifestation if the patient is having osteoporosis with pathological fracture. We need to code these manifestations separately. Okay. So next, spinal disc disorders. Spondylosis is a type of degenerative arthritis by abnormal wear and tear to the spinal vertebrae. Okay. So this is basically spondylosis is the one type of arthritis. For joints, you will call it as osteoarthritis. For spine, you will call it as spondylosis. Okay. So spinal stenosis is an abnormal narrowing of the spinal canal. Okay. Degenerative disc disease is a condition of the disc between vertebrae with loss of cushioning, fragmentation and herniation related to aging. So aging means because of the age. Intervertebral disc displacement is a protrusion or herniation of the vertebral disc resting between two vertebrae. So radiculopathy, basically radiculopathy related to nerve. Okay, so radiculopathy, radiculitis or neuritis. These are the disorders related to nerve, where nerve being pinched by the spine or intervertebral disc. What are the common causes? Aging process, injury and trauma, and inflammation. Okay. Next one is symptoms. What are the symptoms related to the spinal conditions? Back or neck pain, bladder or bowel dysfunction, stiffness, nausea, vomiting. These are the common diagnostic tests for these spinal conditions. Okay. Next, symptoms, diagnosis and treatment options are this one. Pain and anti-inflammatory medications, physical therapy, discectomy, laminectomy, spinal fusion. Okay. So if cervical disc disorders in multiple levels like C3 to C4 and C5 to C6 code only most superior level of the disorder. So among these C3 to C4, C5 to C6, you need to code C5 to C6 region only. Okay. Next, in order to code to the higher degree of specificity of spinal disorder, documentation should include condition. What are the exact condition patient is experiencing currently? Okay. Spondylosis, intervertebral disc disorder, intervertebral disc displacement, disc degeneration, spinal stenosis, foraminal stenosis, or intervertebral disc stenosis. Okay. And also you need to check for it is associated with myelopathy. Okay. So disease of myelin sheath. Neuritis or without myelopathy or radiculopathy. Okay, next as usual, for spinal procedures, you need to check for spine location, whether it is cervical means neck area, cervicothoracic, thoracolumbar, lumbar area, lumbosacral. Most of the time in the live coding, you will encounter cervical, lumbar, lumbosacral, sacral and sacrococcygeal. And next levels, okay. High cervical level C2, C4 levels, mid cervical C4 to C7, C7 to T1. Okay. So we are having one example here. So patient was seen in the ER with left knee pain from several days. Physician ordered for uric acid test for knee pain. After the result, physician diagnosed as osteoarthritis of the left knee. So you need to code M17.12. Okay. So a type 1 diabetic patient is seen in the clinic for her back pain. The examination of her MRI lumbar spine shows that she is noted to have herniation of intervertebral disc in the level of L4 to L5. Okay, how do you code this one? Primary diagnosis will be this one, M5126, other intervertebral disc displacement lumbar region, and secondary code we need to use type 1 diabetes mellitus. Okay, so thanks for visiting Fast Coder 21. If anyone looking for same day surgery coding training, IPDRG training, CCS, SCC, please mention and please send WhatsApp message to 707-526-3939. If you like this session, please click on like button. If you are having doubts, please mention in the comment section of this video.